Good afternoon, and today we have a pleasure of interviewing Dr. Dan Hanson. It's a pre-recorded interview because Dr. Dan is located in Australia with a lot of time difference. Thank you very much, Doctor, for giving us this opportunity.
Yeah, you're welcome. Thank you so much for having me on. Yeah.
And for our audience, if you know someone who have a bad night's sleep or sleep next to the snoring partner, please click like and share button. This way you're gonna help your family or friends with a lot of helpful tip if they're gonna find out the information we share on our interviews on the Facebook, YouTube, and link channels. And this way you can contribute to our mission of making this world a better place, because well-rested person is definitely happy person. And again, I'm going to tell you a little story about Dr. Dan Hanson. He is a founder of the company called Brief Coach. It's a very unique angle because they help people to improve the breathing technique with different methods, including Buteyko and some other technique. So with your breath, you can improve your health. And additional to that, he is the founder of Maya Focus, as a company what educate people on Maya functional orthodontics, and Dr. Dan practiced that way for many years. He did more than 10,000 tongue tie procedures, and today we're going to talk about them. And also, in addition to all of that, he is inventor of Wise Tape. I'm very often, we recommend my patients to use tape to prevent mouth opening at night. So Dr. Dan is going to talk about his invention. And I'm going to ask you the first question, Doctor. Please tell us about your journey into sleep apnea world and how you start being passionate about this area.
Yeah, thank you. Thank you very much. So it really started out with my own health challenges. I was a dentist focusing mostly on jaw joint and sleep apnea type treatments using dental appliances to help bring the jaw forwards. And I was helping quite a lot of patients with that sort of thing. And that was a big area of focus of mine at the time. But I couldn't correct my own sleep apnea. The medical method wasn't working for me, and I didn't want to use a CPAP machine. And so I went very skeptically along to a Buteyko information evening one day. And I thought it sounded like a load of rubbish, and I didn't think it would work, but it was the only thing left for me to try other than CPAP. And at age 31, I didn't want to go on CPAP. I also wasn't overweight and didn't have any other problems like that. I just have a small airway, which is prone to collapsing. And so I went on this Buteyko method, and it very, very quickly started to help me and also the other people who were in my Buteyko class. There were 5 people in that class. One had very severe sleep apnea. The other one had asthma. And I can't remember what the other people had, but we all started to notice some improvements very quickly. And as a result of that, I decided that I had to become a Buteyko practitioner. So I went to the Buteyko Institute of Breathing and Health, which is based here in Australia. And I learned from the same man who learned from the student of Professor Buteyko himself. And it took me 12 months. After 12 months of seeing over 50 clients, I then became an associate practitioner with Buteyko Institute. And since then, I've helped children get off asthma, all ages get off asthma medication. I've helped people with snoring, sleep apnea, and also sports people to improve their sports performance as well.
Oh, we would like, this is amazing technique, and we use it also in our myofunctional practice. And I would like to ask you a little bit more about Buteyko technique in a sense of sleep apnea and asthma and allergy. What exactly Buteyko technique? What it focus on, and what do you change in a breathing technique? Like, if you can be a little bit more detailed.
Sure. Yeah. So in a nutshell, what Buteyko does is it changes the default habitual breathing pattern of the individual. And so everybody's individual breathing pattern is sort of pretty much set as a result of everything that's happened to them up until now in life. So all of the stresses that they've gone through and various other things that's happened to them. And the breathing pattern can be a little bit on the very, very subtly too much hyperventilatory, which means that the person is breathing a little bit too much air, which seems counterintuitive to breathe too much air, but actually you can breathe too much air. When you breathe too much air, you end up with less carbon dioxide in your system. You give too much of it out. And because of that, because carbon dioxide is a requirement for the release of oxygen from hemoglobin to the cells and tissues in your body. So when our habitual pattern is too much breathing, it could be mouth breathing or it could be still nose breathing, but just too much breathing, this becomes a problem for the whole of the body. And then there are various different responses that the body has in different systems in the body, which create then the symptom. Like in asthma, the bronchioles will constrict, for example. And so what Buteyko does is we spend on average, when I would teach a class, it's on average about 5 lots of 12 minutes daily of breathing exercises over a period of time, typically anything between 1 and 3 months on average. And over that period of time, we can change the brain's response to carbon dioxide such that when we are unconscious of how we're breathing, so when we're asleep or when we're just on the computer or walking down the street, our breathing is better. And so we consciously change the breathing pattern in order to change the unconscious breathing pattern over time. And this is using something called neuroplasticity, which is the brain's ability to change. Just like a tennis player, if the tennis player wants to hit a good forehand shot, then they need to practice it consciously over and over again. They need to repeat that action over and over again, and eventually it becomes unconscious. It's the same with the brain's response to carbon dioxide and the body patterns with breathing.
This is so fascinating. Basically, you reprogram the whole body with Buteyko technique, and as a response, somebody get rid of the allergy or asthma. I think it's just so great. But now I want to go into the different angle. And I guess it's a response to your Buteyko knowledge. You invent something called white sleep. And I mentioned that earlier. Can you please introduce us to your invention? And what issues, what challenges did you overcome with it?
Sure. Well, it's called Sleepy Strip, and it's shaped like a Y, which is why you call it Y Strip. But it's this is it in a packet here, in a little sterile packet, and I'll just show you it very briefly. This is the box. It looks like this. You can see it at sleepystrip.com, and basically, so I'll show you what it looks like. This is why you called it Y Strip, because it looks like this shape. But basically, when the Buteyko technique, we normally use a little bit of tape over the lips. And it can work quite well for lots of different people, normal micropore or 3M sort of tape. But my wife started using this technique, and she found that when she was wearing the tape often, her lips would become sensitive and she would get dry and sore lips. And so I decided to invent this type of tape here, because now the stickiness goes on the cheeks here and here, and also down underneath the chin here as well. Now, I made it so that as a sleep dentist, I want to bring the jaw forwards as much as possible. And so the bit that goes underneath the chin actually helps to keep the chin forwards. You see other people using all kinds of things like a chin strap, which goes over their head, but this is not very good at all for the jaw joint. It actually damages the jaw joint over time. And I never recommend using a chin strap. But basically, this is a different way of achieving the same thing. And it has holes so that we can actually then, if we're a bit anxious about maybe putting this on, we know that we can still breathe through it if we need to. And the holes can be made bigger. You just take a pair of scissors and you cut across here and here, and you make this into a bigger hole, maybe for the first week or two while you're getting used to it. So that's why I invented it, because it's when we keep the mouth closed during sleep, it means that the air goes through the nose, and the nose warms, filters, and humidifies the air. And it also slows the flow of the air down, which is very, very important to reduce airway collapsibility. Have you ever, Maria, I'm wondering whether you've ever sucked a paper straw and you find that the straw will collapse. But if you suck that straw very gently, it does not collapse. And so it's the same with the airway. If the air is going in through the airway and out through the airway slowly, then it won't collapse as easily. And so by slowing the breathing down through the nose, keeping the mouth closed, it helps.
Oh, this is a great analogy with the straw. I usually use the same analogy with the straw when I explain to my patients what it doesn't have to be a big straw. It just have to be really tall straw, like, what does not collapse. But then now I can add to the picture with the slow breathing in and out to prevent it collapse. You're absolutely right. I have a straw right here to show. No, that was a great analogy. Thank you very much. That's such a great idea. But now, besides the white strip, I want to ask you kind of like a next step about the tongue tie. I know you did significant work with the tongue tie, and of course, there are different populations. There are some, infants who need to have a breastfeeding, and that's very important part of the population. But some people, unfortunately, didn't have it early in life. I want you to touch base on both of these populations, because I notice very often I mention to people, I educate the people, and even they go through my functional therapy course. But then at the last moment, when they have to really proceed with procedure, they feel uncomfortable and then don't do it. Can you please talk a little bit more about the procedure and, your experience with that?
Yeah, I mean, obviously the procedure varies a lot according to the age of the patient. So in a baby, it's a very quick procedure. In my case, probably maybe 20 seconds for the tongue and 20 seconds, and maybe 5 to 10 seconds for the lip. I use a laser. I used to use a laser called water laser. There's lots of different lasers out there. But with the adult or a child, I would give anesthetic, local anesthetic, a little bit like a dental treatment under the tongue. After putting some topical on, we can gently give local anesthetic. It's not always excruciatingly painful or anything like that. There are good ways of doing it. We make it numb. And then generally the surgery, depending on the case, can be different. So an average surgery is maybe done within 5 minutes or so. And then I got into the practice of suturing afterwards to help with the healing, although for many years I didn't suture. But if in some cases when it's a more complex procedure and there's a little bit more to do, it can take a little bit longer than 5 minutes, but it's very quick. It's a quick surgery, and it's done under a local anesthetic, the way I would do it. That's what you're asking? Like
no, that's what I asked, but I would like to know how that procedure, yes, that was my question. But in addition to that, I would like to know from your experience what benefits you saw for people, who have it done in related, maybe to posture, maybe to sleep. I'm sure you've seen it all, but basically, as a practitioner who done so much, I would like to know what's the benefits you saw on your patients.
Yeah, so I'm going to share maybe 4 or 5 very quickly cases that at different age groups that always I will remember, I think, until the day I die. So for example, a baby whose mother the baby's 3 months old, and the mum has never been able to breastfeed since day one. Her nipples are all damaged and traumatized. And then we do the surgery, and straight after the baby is able to feed, and the mother just cries tears of joy. And then at a review at 1 month and 3 months, the baby is still feeding. And then I see this child when they're 2, and the mother says to me that she managed to keep feeding the baby for as long as she wanted until they were 18 months old. And the baby's face has developed well and everything else. So that's like one example. I remember a toddler who barely could speak. She just, for some reason, she was able to speak but didn't. It was like she was very shy or something. It was unusual. I did the surgery actually only on the lip for this particular child. This was all that was required, which was interesting. And the mother said to me on the way home, it was like she was a different girl. It was like as though she had had some kind of emotional release, and she began to sing for the first time. all kinds of interesting things can happen when we release tissue that is too tight within the body. Other children who have had maybe years of speech therapy and other challenges like that, they're in school, they're being bullied in school because they can't speak properly. And then we do the treatment maybe on a 5 or 6 year old, and without any further speech therapy, miraculously almost, although it's not miraculous, of course, because we know why. If the tongue can't move, you can't speak properly so easily. They're able to then speak again, and almost like spontaneous correction of these things. Sometimes, other times they need a speech therapist, of course. Other cases, an older lady.
Yeah, that's very interesting.
Yep, an old lady. She was in her late 60s, and she had the treatment because she just found that when she was talking for a long time, she would get tired and start to mumble her words. But we did the treatment, and she came back to me 1 week later, and she said it's like a weight's been lifted off of her shoulders, and all of the tension in her shoulders seems to have gone away. And she felt she could do all kinds of physical activities that she wasn't able to comfortably do before. And she was in tears. These are just a few examples that I've pulled off the top of my head, but we see this so many times. We do the surgery for one reason, and then something that the patient hasn't described to us as being a problem, they say, oh my God, I didn't realize it could possibly be related to this, but now it seems like this has gone away. So there are many reasons to do it.
I would like to ask you specifically about the tongue tie, because, as a dentist who treat a lot of sleep apnea patients, I notice when people have a tongue tie, they have a lot of exostosis under the tongue and some bone loss. But, that's all true. But I'm wondering if you notice changes in the sleep pattern after the tongue tie release, or, what's your opinion about that?
Yeah. So much of the time with the tongue tie release, we will see improvements in sleep pattern, both from the patient, just what the patient's describing as how they feel, and also, obvious objective measurements of that, like they not gasping for air anymore, or snoring less, or not snoring. The exostosis, as I'm sure you know, Maria, they're caused by the muscle pulling on the bone and causing the bone to grow more in response. When muscle pulls on bone, it grows. And so these muscles so the exostosis is just a symptom of the fact that the tongue has been tight and tense the whole time, because it's connected to these muscles that connect into the bone, basically. So yeah, we're likely to get less exostosis, and exostosis can be a problem because if they continue forever or ongoing, they make less space for the tongue in the mouth. And then, of course, the tongue has nowhere to go but sit on top of the airway, which makes more sleep apnea or more snoring. So it's important that even if we're not going to remove the exostosis, that we at least try and minimize them to continue to grow, because we don't want them to take the space for the tongue in the mouth. So basically we can notice those sorts of improvements: snoring, sleep apnea, and so on.
Yeah, I really hope what your speech would inspire my patients to follow this direction. But now the very, I would like to find out, and thank you very much to all our audience, and we would like to know who you are and where you're coming from, even on a pre-recorded interview. If you can put your name in a comment box, we would like to acknowledge all of you. Thank you very much for listening. But my question to you, doctor, about the company you founded called Maya Focus, and that's kind of a new concept for us in the United States, or at least I didn't come across myofunctional orthodontic. It's not such a common concept. As people who involved in the sleep, we all understand how form follow the function and how important in establishing the form to address the function. Can we please talk about basic principles of your Maya Focus company and what you were able to accomplish practicing that way rather than traditional orthodontics, or two separate entities?
Sure. And so I founded MyoFocus with my wonderful business partner, Dr. Donny Mandrara. So I want to mention his name here as well. And it's interesting that you say that you haven't heard of that so much over in the States, because actually the US is the biggest customer for some of the appliance companies that we use to help with myofunctional orthodontics. And so it is very, very much used in the US, but it's really interesting that certain pockets of the US have heard of it and use it a lot, and others have not. The principles are simple. So basically, I say to parents or children, imagine the tongue, the lips, and the cheeks are much like the sculptor for the face and the jaws and the teeth. And imagine the jaws and the teeth are like a piece of clay, a soft piece of clay. Now, however these muscles are working, that is the sculptor, and that changes the shape of the jaws and also where the teeth sit. And so the teeth sit in a position of neutral force balance within the jaw bones. And the jaw bones themselves are also grown, particularly by the tongue being in the roof of the mouth, will grow the top jaw like this. And so if I swallow normally with the tongue up into the roof of the mouth and there's no contraction of my cheeks or my lips, then I get good force patterns onto my teeth and jaws, and that helps everything to grow and be straight normally without any problems. When the swallowing is dysfunctional, the swallowing pattern is dysfunctional, we get the cheeks compressing in or the lips kind of being tense at the front here, and that creates a narrowing or a crowding of the teeth in the front region there as well, for example. And so with myofunctional orthodontics, what we're doing is, as early as possible in the child's lifespan, we're making sure that the muscles work properly. This is why myofunction means muscle function. And we are, by doing that, we're assisting the jaws and teeth to grow normally, basically. We can still treat cases, up to age 11, 12, 13. I've even had some good cases in the ages sort of 15 and 16, but they get much more complex. And often we need to use some orthodontics or something as well in order to get the right result. But 100% of cases that we would treat in our clinic in Melbourne there in the MyoFocus clinic would have myofunctional therapy, which we call the Takeoff program. That's how our branded name for it. But we combine myofunctional therapy with myofunctional appliances to help make the jaws and the muscles work properly. And then we only use something like Invisalign in very rare cases if the teeth are not in perfect position at the end of treatment. But always we treat first myofunctionally, particularly if the teeth are still coming through. And our youngest patient would, of course, be the tongue tie, because we treat tongue tie there. So that would be like 1 day old, 2 days old, potentially. But actually, we'll still treat orthodontically a 2 to 2.5 year old with myofunctional orthodontics. Obviously, much more simple appliances and things that we get the child to do at that age. But we can affect the child very, very early on, from very quickly when they're young as well.
Can you please let us know about what type of appliance you use for the younger population? Like I'm talking about very little, like if you can talk a little bit about Myomanchi maybe, and some other appliances to make my audience familiar with that concept. What if somebody feel that they have a younger, if they have a child and they want to prevent child growing into sleep apnea future, what they can start early and use this technique, the technique you use, what form follow the function, and just maybe later life just to correct the position of the teeth aesthetically, but in a correct way.
Sure. There's a few sort of angles I'd like to answer that from. When you said the thing about trying to prevent the child from having sleep apnea when they're older, of course, myofunctional orthodontics and myofunctional therapy is a big part of that, and it can do a lot of it. But I have my 5 pillars of health, which are really, really important for all aspects of health, actually, including sleep apnea. And they are detoxification, nutrition, breathing, mindset, and motion. And so what I mean by that is I make sure that parents know we could do myofunctional orthodontics and do everything else, and the child still may have sleep apnea when they're older or sleeping problems because they have poor nutrition, they have a poor environment, they're on screen technology after dark, they're stressed because their parents are not spending enough time with them because they're always at work. There's all of these different things that can affect the child's nervous system, and the nervous system is what drives the breathing pattern. And so myofunctional orthodontics is a big part of it, but we have to look holistically at the whole picture. To answer the question directly, though, with Myomunchi, for example, very simple exercise. You might imagine a 2-year-old child. They've been sucking their thumb, and that's created an open bite, and they're not sleeping well, and their jaws are not growing properly. Well, you need to replace the thumb with something. And so one thing that you can do, for example, is you can give them a myomunchie, an appliance for them to express all of that nervous energy on, that they're getting an emotional release when they suck their thumb. They're also expressing that through the myomunchie. It's like looks like a little mouth guard, and they sort of chew on it. And while chewing and swallowing, the myomunchie is also helping to direct the muscles to train to learn to swallow properly. And we're also getting some more functional chewing, which is very important for jaw growth. And just imagine you're a parent with a 2-year-old child. Maybe they like bath time, or maybe they like reading time. Well, what you do is you get the myomunchie, you give it to them, and you give it to them only at a time that they enjoy. So say you're reading a book to them in bed. While you're reading, they're chewing on the munchie. And then if they stop chewing on the munchie, you stop reading, and you make it into like a fun game. Same with bath time. They enjoy their bath. So the bath time is also munchie time. And this is how we can work with a very, very young child. Close their open bite very quickly, get them off of their pacifier habit, and other things like that. There's lots more we can do, but I'm trying to be quick.
It's all fascinating, really. And for the a little bit older population, like I guess Maya Brace, can you talk about this a little bit? But I absolutely admire how you said about the art, the sculpture, and the clay. I think it's such a great analogy.
Yeah, thank you. Yeah, I mean, parents understand that analogy really well, and so do children. So it's a really useful one. Yeah, for the older children, there are a number of different myofunctional appliances, and MyoFocus itself is not. I worked for MyoBrace and lectured for MyoBrace all in different parts of the world for many years, which is why I have this background knowledge. But we don't exclusively use MyoBrace, but that's one of the main appliances that we would use at the moment for sure. And so with MyoFocus, we will use a combination. Say for example, it's an 8-year-old child. We'll use a combination of myomunchie and myofunctional therapy, and then they will graduate from our main myofunctional therapy program and graduate onto a MyoBrace, and then they'll continue in myofunctional therapy then as well. Occasionally, if we need to expand the jaws with an appliance, we'll use some appliances to expand, for example, BioBlock or something like that. But much of the time, if we get the child young enough, we will use a MyoBrace, and they will use that for maybe 1 to 2 hours in total each day while they're awake. Could be while they're watching TV or reading a book or traveling to school in the car. And also they will sleep in it at nighttime. And initially it will fall out at night. Eventually, when they'll get used to it, it will stay in at nighttime. And this is when we'll start to get big improvements in the way the jaws are growing.
Oh, I absolutely love it. I think it's so logical and so wise, and kind of work, I would say epigenetic way, like giving the chance for genes to develop in a correct way without interference from, other habits. But now I would like you, doctor, to give us some practical tips. I know you have a lot of knowledge about the breathing, and I want to mention, different techniques what you use besides the Buteyko. Like I saw the pictures of people staying in the ice bath. I think it's wonderful what you can accomplish. I would say beyond the limit, such a challenge, such a, incredible technique, just using the breath. Yeah, I want you to talk maybe a little bit about that. It's I know it's not part of treatment, but I find it fascinating. But what I really want you to do, if you can teach us the practical tip, what type of breathing, myself included, I have to use when I want to go to sleep. How can I calm myself down and unwind the day with a proper breathing technique?
Yeah, okay. Well, I'll answer the last question first then. So it really depends on the situation, is the reality. So there's lots of different breathing techniques which can help to waken up the parasympathetic nervous system and quieten the sympathetic, which is the fight flight. We want to quieten that down and get sleep happening. So there's lots that can be done. Generally, slowing the breathing down is the first thing. But if I'm extremely stressed and my brain is kind of like thinking about lots of thoughts and I can't get to sleep for that reason, typically, it's something like very, very long, slow exhalations with a small inhalation, very long, slow, just slowing everything down. So maybe your listeners are watching now, and you can just slowly breathing in, like not breathing big breaths, but just slowly breathing in for maybe 5 or 6 seconds, and then slowly breathing out for maybe 5 or 6 seconds. And this is sort of what's called coherence breathing, and it's a way of calming things down. That those sorts of things can be useful, and they can be practiced. As far as getting so that's sort of just before bed, but as far as actually getting a good night's sleep on a continuous basis, as well as making sure that your 5 pillars of health are in order, which is always the thing to do. It's basically, the Buteyko breathing is what I would be using, which is, practicing slowing the breathing down. We'll give you a quick example of Buteyko breathing now, maybe. You would always make sure you're nice and comfortable. You're sitting upright on a chair. Your shoulders are relaxed. Make sure that your belly's relaxed so that you can breathe down towards your diaphragm. Make sure your lips are closed. Start becoming aware of the air going in and out through your nose, and just become aware of how much you're breathing in, and then relax on the exhalation. And then from that point of awareness of how much you're breathing in through the nose now in this moment, which will be different to a moment maybe an hour ago, from that point of awareness, slightly reduce the amount of air that you're taking in through your nose, just very slightly, like it's a 90% in-breath as opposed to a full in-breath. Still coming down to the diaphragm, but very, very minimal. You're breathing, it's almost as though you're not breathing, actually. And then relax on the exhalation, and then repeat that process of breathing just slightly less air than normal in through the nose, relax on the exhalation. You should feel like you're not quite getting enough air. We call that air hunger or a thirst for air. You're actually getting plenty of air. What's happening is you're getting an increase in carbon dioxide, which is what you're feeling. And it's this tolerance of carbon dioxide that we need to develop over time consciously in order to slow down the unconscious breathing pattern to sleep better. So that's a really quick guide of the main therapeutic exercise in the Buteyko method just now. But Buteyko is much more than just that, but that's just an example.
Basic.
Yeah.
That's very interesting. And that would be a great tip for my listeners before they go to sleep. 5 pillars of health. I think that's really valuable. And to kind of focus on getting the air out and not to breathe too much in, right? That would be the main idea of that.
Absolutely. Yeah.
And thank you very much. We really appreciate you gave us so much knowledge. And now, Dr. Dan Hanson also conduct breathing courses through the virtual way. So we're going to put the information about him. And, if you have any questions, please put in your comment box and we will find you the answers. Again, thank you very much, Doctor. We really appreciate what we met the challenge with the time, and we're looking forward to see you again.
Thank you so much for having me. I appreciate it. Thank you.